Hi, I'm Bob Garrett, CEO of Hackensack Meridian Health. It's my privilege today to welcome you to our series on the importance of maintaining a healthy mind and outlook during the COVID-19 pandemic. We've never experienced a healthcare crisis like this in our lifetime. Our health network, New Jersey's largest, has treated more COVID-19 patients than any other health system in the entire state. I salute our healthcare heroes on the front lines and all the team members who support their extraordinary work. We're all in this together. We will continue the hard work of recovery. That's why we built this program with our families, our communities, and our state in mind. We are making major strides in behavioral health care in our state and in our nation. As a health network, we are transforming behavioral health care in many important ways. We're making it more accessible. We're making the treatment of addiction and mental illness a comprehensive part of healthcare. And we're working hard to eliminate the stigma around these chronic illnesses so that people who need treatment will reach out for help. This pandemic is taking a toll on all of our communities. This crisis has upended our lives. There's uncertainty, and sadly, for many people, loss of jobs, or even worse, loss of loved ones. What you will hear in the next 15 minutes will be very helpful to you and your families. The merger of the Carrier Clinic and Hackensack Meridian Health last year expanded the ranks of exceptional providers. We are living our mission to transform behavioral health care. We have opened the state's first urgent care behavioral health center so that people have options beyond the emergency room. We are opening a new state-of-the-art destination addiction treatment center later this year in Mahwah, New Jersey, because there's so much need for high-quality, comprehensive care. In a few minutes, you will hear from two of our top experts in the field of addiction, Dr. Juliette Caldwell, an internal medicine specialist with more than 20 years of experience, and Stephen Jurachevsky, a licensed drug and alcohol counselor and the director of Hackensack Meridian's Retreat and Recovery at Belmead. They will fill you in on the psychological effects of COVID-19 and how for some people it can lead to abusing alcohol or drugs. They will help us understand the psychology of addiction and what type of treatment is available. On behalf of our entire network, thanks for joining in this important conversation. Remember, we are here for you and your family. We are all in this together.
Good afternoon. I'm Dr. Juliette Caldwell.
And I'm Steve Jurachevsky, and we're here today to talk to you about the COVID-19 pandemic and the way that it's affecting substance abuse and substance abuse treatment in the world today. We know that COVID-19 has been around for a little while now, and it's definitely caused a negative impact in people's lives. We know it also has caused a dramatic increase in substance use disorders, and we're going to talk about that with you and hopefully give you some great insight into if you're a person who has or knows somebody with substance use disorder during this time, how you can handle it, what you can do, look what signs and symptoms to look for, and give you a good understanding of substance use disorders, because we actually have two things going on right now that are, we have the pandemic, the COVID-19 pandemic, and opiate use disorder pandemic as well, or epidemic going on at the same time. So two very important things going on that are causing a terrible impact on society today. Addiction is a biopsychosocial disease that not only affects the person who is suffering with the disease, but also the people around them. It affects family, friends, coworkers, neighbors, in a whole bunch of different ways. And remember, biopsychosocial. So what does that mean? It means that a person is affected in a biological way. It means their body and their chemicals are being disrupted, their neurochemistry is being disrupted. Their psychological states are being disrupted in a negative way, and it's causing social impact on their life. The other thing I like to add to that is spirituality. We know that substance use affects a person's spirituality in a negative way as well, and we got to remember it's very important. So I like to add biopsychosocial spiritual to that. The disease of addiction has signs and symptoms. That's why we know it's a disease that are, it is progressive. It is chronic and potentially fatal if untreated. But it is treatable, and that's important to recognize. It's important to understand that addiction is a treatable disease. There is hope. People do get better. We talk about chronic, progressive, potentially fatal. We look at other diseases that follow that same format, such as cancer, diabetes. These are chronic, progressive, and potentially fatal as well. Unfortunately, there's a huge stigma when it comes to addictive disorders. We expect people to just change their behavior, or, you wouldn't ask somebody with cancer or diabetes just to, stop, just stop being a diabetic, just stop having cancer. So, but we expect that from drug addicts. We expect that from people, addicted people. We expect that from people who, have behaviors, and these things need to change. And we think it's just purely a behavioral problem, which is part of the stigma. And we need to really address that as well. So that's part of this presentation as well, trying to stop the stigma of addiction as well in this very difficult time. People can be addicted to a whole bunch of different things. People can be addicted to opiates, such as oxycodone, hydrocodone, Dilaudid, morphine, heroin. These are all the things we hear a lot about. The big one now we hear a lot about is fentanyl, benzodiazepines such as Xanax, Valium, Ativan. These are all things that are highly addictive, and very important to recognize. Nicotine, also probably one of the number one addictions in America today, but often understated. And people can also be addicted to cannabis. People can be addicted to processes as well, or actions, right? So these are also very important to understand. I've seen a lot of people come in for drug addiction and do well and get sober and get clean from drug addiction, and then develop a process addiction such as gambling, shopping, internet, sex, work. People often become workaholics, right? Or gaming is another big one right now. Gaming addiction. We are actually seeing people come in and actually self-report at this point that they think they have a gaming addiction, which is, and there's a lot of research coming out right now. Also I think underreported and underlooked at is gambling addiction in substance abuse. I think we often glance over that, where you have probably about a 60%, maybe 50 to 60% of the people we treat also probably have some type of gambling addiction or lean towards that as well. So we got to make sure we also evaluate for that. And people are often addicted to more than one thing. All right. So that's also important. So, and I'm not just talking about drugs. Yeah, we see that a lot. We see opioids and benzos. We see alcohol and opiates. We see a lot of that. But sometimes people are addicted to, let's say, cocaine and gambling tend to run together, right? Because a gambler's always seeking action, whereas a cocaine addict is pretty much always seeking action, right? It's kind of the same type of, it fits well. And we see a lot of those run hand in hand. So when you see somebody that has a stimulant addiction, you really want to check and make sure and look at the gambling piece as well, because it's a probable that they might be dealing with that as well. So really important. So process addictions also have the same biological reaction in the brain as we see in an actual substance use disorder. So some of the same chemical changes happen in the brain as when someone places a bet, when someone gambles, when someone goes on and starts gaming. So it's not unlikely that someone will recover from addiction of a substance use and then end up in a process addiction. Alcohol is still the number one abused drug in the United States, probably in the world. And that's important to understand as well. It's also the most underreported and undertreated drug addiction. And alcohol is a drug. Just want to make that very clear. Alcohol is a drug, just like opioids, a matter of fact, here's an interesting distinction for you. If I took, let's say, 100 people on opioids and put them in a room and let them detox for 3 days, and I took 100 people on benzodiazepines, Xanax, Valium, Ativan, let them detox for 3 days. And then I took 100 people on alcohol and put them in a room and let them detox for 3 days without giving them any medications at all. There's a percentage of those alcoholics that will probably be dead. There's a percentage of the benzodiazepine users that will probably be dead. The opioid users will not be. Opioids are not life-threatening in withdrawal. they are life-threatening in continued use. Alcohol use disorder, being as underreported as it is and minimized as it is, we have to understand the danger involved. You shouldn't detox yourself from alcohol. You should always seek treatment. And like I said, it's a dangerous drug. It can kill you in withdrawal, same with benzos. So those are important facts that a lot of people don't realize. And I just think it's important to know.
That
Please.
although we are in the middle of an opioid epidemic, alcohol is always and has been the #1 killer. So just keep that in the back of your mind, that alcohol has been around for a long time, and it still is probably the most harmful substance of use out there.
Yeah, and it's people, accidents and withdrawal and just poisoning itself. There's a lot of ways, unfortunately, that alcohol has a negative impact on people's lives, and the fact that it's just people underplay it, because it's so socially acceptable. So it's an important thing to recognize. People are drinking more earlier in the day right now. We know that people are because of the COVID-19 pandemic, we know people are home. we know alcohol sales are up 75% in some areas when we look at, spirits. So we know people are drinking hard alcohol. We know that, beer still probably the second most popular in a lot of areas at 66%, up 66% in some areas, and wine is up 42% in some areas. And we're looking at that in comparative to years prior, right? So for the time since the pandemic has started to years prior, these are the increases we're seeing. So we know people are drinking more. We also know that interpersonal violence, which used to be domestic violence, is up as well. So now you think about that. People are stuck at home. People are told to isolate. People are told to, quarantine and don't leave the house. And, they're drinking more alcohol. So we're anticipating a sharp rise in interpersonal violence as we get numbers as we go forward. So just another important piece of this to keep in mind. National overdose statistics, we have a lot of those, and these are numbers that continuously keep coming in. We know, and we're always about 2 years behind. So, we know that in 2018 that we saw 67,367 overdose deaths in the United States. We also know that they're mostly opioid and synthetic opioids primarily. So that's an important thing to understand. Opium based drugs are, and I want to kind of break this down into 3 categories. Opioid based drugs are codeine, morphine, heroin, of course. Then you get into the synthetic drugs, which are Dilaudid, Demerol, fentanyl. We hear a lot about fentanyl right now. Fentanyl is a big contributing factor to opioid overdoses in the United States today. And probably throughout the world. And there's another one now called carfentanil, which is even more powerful. So as if fentanyl wasn't scary enough, now we have carfentanil to make us even, to really add to the injury here. And I'm going to show you a picture in just a second, just to give you a comparative on that. And then we have semi-synthetics, which are oxycodone, hydrocodone, and those are kind of a mix of the opium-based drugs and the drugs that are basically synthetically created. All right. So, and they're very powerful as well. So in New Jersey alone, in 2018, we saw 3,118 overdose deaths in New Jersey. And, in 2019, we saw it drop just a little bit to 3,021. And then so far between January and May of this year, we have seen 1,339 overdose deaths in New Jersey, and that actually puts us on track to beat the 2 previous years. These are scary numbers, and like I said, these numbers keep coming in, and they change and I'm expecting it actually to go up, which is unfortunate.
Yeah, as compared with last year at the same time, we're having about 20% more opioid overdose deaths as compared with last year.
Yeah. So very important stuff. Now, this is what I was talking about a couple of minutes ago. This is, just a comparative. What you're seeing is heroin as compared to fentanyl, as compared to carfentanil. Now, if you look at heroin, there's a little bit of a pile in there. If you look at the fentanyl, there's, that's kind of a scary thing right there. And then, look at carfentanil. That's like a speck. So that speck is as powerful as that much heroin. Now think about this. Now, drug dealers are cutting heroin with fentanyl, not to purposely kill people. That's not what they're trying to do. They're trying to make it more impactful. They want, remember, this is what it comes down to, and get inside the mind of an opioid addict or a heroin addict. And I could tell you from talking to many over my career that, if there's something that they hear is killing people, they're looking for it. All right. And it's not because they want to die. It's because they think that must be really good stuff. It's, I'll just use a little less, right? That's the mindset of an opioid addict. That's the mindset of a heroin addict, is I'm going to go out and find that. I mean, they come in little glassine bags, and some of them say things like body bag on them. Think about that. Someone's out there. This is the mindset. Like I said, this is how an addicted person to opioids mind starts to think after a while. And it's really important to understand it. So drug dealers aren't trying to kill them. They're just trying to make it have a big punch so that the person keeps coming back, because they want them to come back to them. They want them to seek out it's called a stamp every single time. They want them to seek that out. And, because they don't want them to go to somebody else. All right. And unfortunately, as a byproduct of that, they're not sitting in a lab somewhere mixing this stuff up. They're sitting in some apartment somewhere saying, hey, it looks right. Right. And definitely, unfortunately, what happens is people die as a result.
So the more potent an opioid is, such as fentanyl and carfentanil here, the more of a high you get from it. But also you have increased respiratory depression. And that's what, so they're looking for the euphoria and the high, but along with it their respiratory depression gets suppressed even more. And that's, of course, how they die, is from basically stopping breathing. Yeah.
Because we know that when you stop breathing, then other systems start to shut down. And then, pieces of your brain start to, die, and then you pass away. Unless you're, we have Narcan and things like that. You got to remember one thing too, that, and this is, just good information, is sometimes, Narcan doesn't always work the first time, second time, or the third time. So this stuff is very powerful, very dangerous. And, we see a lot of overdoses, and, these are things we need to start to, we have already started a long time ago trying to address this, but I think due to the pandemic, we're going to see higher numbers. We know, here's another reason, we know people are feeling more anxious and having more mental health issues right now as well. And we know that because we know that prescription sales are up. We know that anti-anxiety medications are up a large amount from the same period last year. We know that prescription antidepressants such as Prozac, Lexapro have rose quite a bit since the pandemic started. There are reports that by Express Scripts that anti-anxiety medications rose 34% from mid-February to March, to mid-March. That's a huge jump in anti-anxiety medications. So we know people are feeling this, right? We know people are feeling. Now, what happens when an addict feels anxious or depressed, or they try to feel better, right? And what does that for them a lot of times is drugs and alcohol. And that becomes their coping skill with those feelings. And it's really important that we start to address people's anxieties and fears and depression in a way that gives them other coping skills, so they do not have to resort to drinking alcohol or using drugs. We also know that psychiatrists wrote about 86 more percent prescriptions for antipsychotropic drugs, primarily for depression in March and April of 2020.
So the COVID pandemic is certainly affecting each and every one of our mental health and well-being. But for those of us in our population who are more at risk for depression, anxiety, addiction, we're going to see more of them actually express that disease in a full-blown way. We're going to talk a lot about the disease model of addiction, because for so long, addiction has sort of been misunderstood and stigmatized. And it's not hard to understand why, since, you observe someone who's addicted to a substance, and they, despite devastating consequences, for instance, loss of their family or loss of home or joblessness, they still return to using their drug of choice. And it's baffling to us. Why would this person continue to do something so destructive? So it's very easy to look at them and say, well, it's a moral failing. It's a choice on their part that they're making, and not truly a disease. But as science has advanced and we've gained more literally like imaging into the brain, more ability to do functional MRI and study the adaptations that occur in the brain due to drug use, we're starting to understand the reasons why addicted people behave the way they do. So much the same way in diabetes, I like to compare it to diabetes, where the insulin that the pancreas is supposed to produce gets diminished, and they can no longer produce enough insulin to supply their body with the glucose it needs. Well, over time, the addicted brain undergoes neuroadaptations such that it can no longer produce the natural pleasure neurotransmitters that it needs to enjoy life on a daily basis, to enjoy the natural rewards of life and feel gratification from daily living. So it's really actually very similar. Nobody is born with a disease of addiction, but they are certainly born with a genetic predisposition. And it's quite a large component of risk that is found in the genes. About 40 to 60% of the risk of a person becoming addicted to a substance is determined by genes alone. So that certainly argues in favor of the disease model. However, the other 40 to 60% of what determines if someone's going to become addicted is the environment. And of course, that is what is changing so dramatically with COVID-19. Our environment has become so stressful and full of fear of getting sick, fear of financial insecurity. All these stressors are going to play into the environmental component that can activate addiction. And do you want to add something?
I was just going to add that, this has been this is like probably one of my favorite slides. And I'm going to tell you is because, when you get into nature versus nurture, that's been an argument in the scientific community for a long time. And it's been, no, it's nature, no, it's nurture. And we finally, over the last few years, gotten to a point where we say it's both.
Yep.
It's not just one or the other. It's both of these things combined, creating and we're going to talk about a little bit of a perfect storm later, but, this is a different kind of perfect storm. It's creating the right mix to create an addict or a person who's addicted.
Absolutely. And it's not just a simple equation of environment plus genetic risk. It's actually a dynamic interplay between the two. So that what we're finding is that the environment that we're in actually affects the genes that get expressed in our body. And it's actually rather fascinating. So this is a pictorial of something called epigenetics. And basically, if our environment is stressful enough or negative enough, if someone undergoes trauma or loss or financial insecurity, the actual molecules change on our DNA. So you can see here that little methyl groups get added to the double helix of our DNA. And the histone, which is the protein that the DNA wraps around, its shape changes. And that means that the DNA unravels in a different way and different genes get expressed. And in the case of addiction, the genes that get expressed are ones that lead to addictive behaviors. So compulsivity, poor decision-making, poor impulse control. So it's actually definitely not nature versus nurture, but nature and nurture. And there's a dynamic interplay between the two. What's also fascinating is that these epigenetic changes are heritable, so that this is why we see a sort of compounding of risk for addiction through families. So for instance, if I'm born with a 20% risk of becoming addicted to a substance, and let's say I'm exposed to the right negative environment, I have some trauma in my life, I perhaps experiment with drugs and alcohol at a young age, my epigenetics change in this manner. And it leaves a blueprint on my DNA. And so if I have a child, that blueprint actually gets inherited by my offspring. So that added risk actually gets transmitted down. And that's why we see this sort of compounding of risk through generations. We're just going to take a moment to focus in on the opioid epidemic because, as Steve pointed out, we are in the middle of an opioid epidemic. It's hard to remember that because when we turn on the news, all we hear about is the COVID pandemic. And although alcohol still is the #1 killer, opioids, because they're so dangerous from an overdose perspective, are killing people rapidly and in their youth. So this is a nice graphic that you can find on the CDC website outlining the loss of life since 1999. The purple represents the first wave and escalation in the loss of life, and that was due to the overprescribing of painkillers, which we could get into further, but the medical community did finally catch on and tamp down on their prescribing practices. And yet we had people who were addicted to opioids at that point. So they had no choice other than to really turn to the streets and buy heroin. And that's that second yellow line. And you can see it's a steeper incline in the rate of deaths that occurred because heroin is obviously more powerful than over-the-counter painkillers. And finally, the last and most dramatic rise in overdose deaths occurred around 2013, and that's when the drug manufacturers, the illicit drug industry rather, caught on and started mixing in these very potent analogs of fentanyl and carfentanil. And that's that very steep rise in deaths that we saw from 2013 onward. The last thing I want to point out is that we were finally starting to make a little bit of headway in our addiction treatment. And you can see there both the purple and the orange lines there, finally the curve bending down slightly, showing a slowing in the rate of overdose deaths finally around 2017 and 2018. But unfortunately, because of all the factors we're talking about with COVID, I'm afraid that gain is going to be lost due to a growing population of addicted people in our community because of COVID. So just don't forget that, yes, COVID is the pandemic that is occurring now and is probably at the forefront of most of our minds. But in the background, we are still in the middle of an opioid epidemic and losing lives at a rate of 120 people per day in the United States, or 1 death every 7 hours in the tri-state area.
And it's important to understand that we have like you pointed out, we have a collision of epidemics right now,
Yeah.
really driving a whole lot of this and these increases that we have,
Yeah.
In the substance abuse realm right now,
Yeah.
and the lack of resources and things like that people have to count on. So, there's a lot going on and we
Absolutely.
have to recognize that. You can't lose sight of one to take care of the other, even though COVID-19 is a serious illness and it needs to be addressed and it's a pandemic, but we still have this other thing going on. And I think we need to recognize that.
Absolutely. So to get back to the disease model of addiction, I just want to explain the basics of it. And Nora Volkow, who is the director for the National Institute for Drug Abuse, she characterizes it as the natural reward system getting hijacked. And I think it's a very useful way of thinking about it. So nature designed our bodies to make things that would lead to the longevity of our species pleasurable. So things like eating food, you can see will spike the basal dopamine up to 150 from the baseline of 100. And that's experienced by someone as a sense of pleasure. Sex, if someone enjoys sex, their basal dopamine goes up to 200. So again, is experienced as pleasurable to the person. And that means that the person is going to go back and repeat that behavior. And that was nature's way of designing it so that we would survive as a species. Well, unfortunately, what happens with drugs and alcohol is that reward system essentially gets hijacked and taken over. And with drugs and alcohol, we find a sort of shortcut to those same pleasurable feelings. So you can see here with morphine, the basal dopamine will spike up to 200, cocaine 350, alcohol up to 200, and even just nicotine, it spikes up to 250. So these, drugs and alcohol are pleasurable. People experience them as pleasurable. And of course, that's why they go back and repeat their use. Now, in the beginning, in the experimentation phase, it's not such a big deal. But when someone goes back to chronic repeated use, then the body catches on and essentially adapts to seeing too much dopamine. And the body kind of knows that it's getting too much of a good thing. So what it does is it downregulates the number of dopamine receptors available to feel pleasure. And that is key to understanding why relapse is so common in our addicted patients. So on the left, you can see a normal, healthy subject. And in the center, there's a robust amount of red. And that signifies a normal, healthy amount of dopamine receptivity. So that person is fully capable of enjoying the natural gratifications of life, like exercise, eating good meals, affection, love. That's a normal brain. In the middle, you have someone who was addicted to cocaine, but who has quit for one entire month. And although they quit a month ago, you can see there's very little recovery of that red color in the center of that brain, meaning very little recovery of that dopamine receptivity. And even 4 months after abstaining from cocaine, and that's the picture all the way on your right, you can see only a trace amount of recovery of the red color, meaning only a trace amount of that dopamine receptivity has returned. So what does this mean? This means that this person can really not feel gratified or feel pleasure from the natural rewards of life. There's not enough of a dopamine surge for that person to feel that exercise or food or affection is giving them a sense of pleasure. And that, of course, is why they're so susceptible to relapse, is because they're in a chronic state of what we call dysphoria, which is lack of pleasure, or anhedonia, lack of pleasure. And this has been observed for decades and has been coined clinically as the post-acute withdrawal syndrome. Now we just have a neurobiological explanation for it. And this is when patients tell you that, gosh, I quit a few months ago, but I still feel depressed, irritable, anxious, I can't sleep, I've got no sex drive, I have difficulty focusing on tasks. And that's because these adaptations take months to years to recover to normal. They can and do recover to normal, but they are very enduring. So I like to think about it as in Greek mythology, Tantalus, who was dying of thirst and put in a pool of water, but was unable to dip down and drink from the natural pool of water that was beneath him, unable to quench his thirst. That's how I think of the addicted person in this post-acute withdrawal phase. They're sort of dying of thirst for pleasure, but unable to enjoy the natural gratifications that are available to most of us in life. And that, of course, is why they return to use, because that's the only way that they can essentially feel normal. For them, normal is to return to use, to feel that pleasure. So I'm hoping that we can start to think about addiction just like we think about other diseases like heart disease and diabetes and cancer as really affecting the organ of the brain. And of course, the organ of the brain is what is most responsible for our behavior. So here on the bottom, we have a normal, healthy heart on the left with a large amount of red color representing good glucose and oxygen uptake by the heart cells and a healthy heart. Well, next to it on the right is a diseased heart, and you can see a very diminished amount of red color and poor uptake of oxygen and glucose, so that heart cannot function properly. Well, very similarly, at the top, we have a healthy brain on the left with a large amount of yellow in the front of the brain, representing normal prefrontal cortex activity, normal oxygen and glucose uptake in that prefrontal cortex. And in the addicted brain, right next to it on the right, you can see highly diminished amount of yellow in that prefrontal cortex, meaning that that prefrontal cortex is hypoactive, is not able to function in a normal way that it should. And why is that important? Well, it's extremely important because the prefrontal cortex is what I like to think of as the house of our humanity. It's where our decision-making resides, our ability to think properly, our ability to exert willpower and make good decisions. And so if that's impaired, then of course, the person addicted to drugs and alcohol is not able to make the good decisions he or her once was able to.
And I just want to add, I love this talk and this part of looking at it, because I think it does a great deal to reduce the stigma. Because would you ask somebody with an unhealthy heart just to stop and get better?
Yeah.
You wouldn't, right? You would treat this differently. But yet with someone suffering with the disease of addiction, we tend to ask them just to stop the behavior.
Exactly.
And your pictures of the brain are much better than mine. I use something called a hand brain. And my hand brain is basically, if you think of this as your reptilian brain, the oldest part of your brain, the fight, flight, freeze response. And then this on top of that, you put your thumb over it, and that could be your limbic system. That's your emotional well-being, your emotional thinking. And then you wrap over here, and this is your frontal cortex. And this is your higher level executive thinking, your judgment, your good decisions. And I love that you talked about the brain hijacker, because I look at it like this, fight, flight, freeze. When someone starts to come off of their drugs, they go into that fight, flight, freeze response. That part of their brain takes over.
Yes.
And then drives the decision making. Like
Exactly.
this now becomes, how do I get more drugs? How do I figure out, how do I manipulate? How do I get myself, And one thing I just want to say, addicts are addicted people, and I keep saying addicts, and I apologize for that. Just a long time of me being in the field saying that. But I will tell you that, addicted people are not bad people trying to get good. They're sick people trying to get well. And we really need to start treating them that way. Same thing with the limbic system, the emotions. The emotions come up. You know what the good thing about recovery is? You get your feelings back. The bad thing about recovery is you get your feelings back. Now you don't know what to do with them. And then this part of your brain kicks in, and you maybe make some bad decisions. So I love the way you covered that. That's great.
That's awesome. Thank you for adding that. Yes, so we don't withhold medications from diabetics and just tell them to eat right and exercise and hope for the best. We give them insulin, and then we tell them also to eat right and exercise. Well, the same thing especially for opioid use disorder. We have some very highly effective medications out there that can really help them get through those first few months to years of recovery. Most of these medications that we use actually give back the person a little bit of those pleasure neurotransmitters. So it gives them back a little bit of the opioid peptides or the dopamine. And that basically brings the person from feeling terrible in the post-acute withdrawal syndrome to sort of feeling normal again. And in turn, that allows them to engage in the psychosocial and spiritual treatment that Steve talked about that is so important. And I just want to show you how effective these medications can be by looking at this graph. This is a compilation of data from 3 studies. And at the top in green, we have the general healthy population with a standardized mortality ratio of 1, or standardized mortality rate of 1. The red is an opioid use disorder patient with a standardized mortality rate 6 times that of the general population. So that person is 6 times more likely to die than the healthy average individual. However, if you give them medication-assisted therapy or treatment, we can reduce that mortality risk to a little bit under 2. So a little bit under twice as likely to die as the normal average individual. So that is a huge mortality benefit that you gain from using these medications, particularly in the beginning. And not only does it decrease their rate of death, but it also decreases their risk of relapse by about 66%. So we're talking about highly, highly effective medications that are available to our patients with opioid use disorder. I might add that we also have a wide gamut of medications available for alcohol use disorder that are also quite effective. I'll name a few: naltrexone or injectable Vivitrol, acamprosate, or even gabapentin. All these medications have been shown to decrease the rate of heavy drinking, and in some cases, even increase the rates of abstinence. And they are highly underutilized and available to our patients. So that's another way that we can help treat our patients with addiction to alcohol. And do rest assured that all the medications I'm talking about are well studied and highly endorsed by all the major medical societies. So the Surgeon General, the World Health Organization, the National Institute on Drug Abuse, all major medical societies have endorsed using medication-assisted therapy for alcohol and opioid use disorders. I just want to explain that although I talk a lot about medications, they are not a cure. They are not a cure for addiction. It's not going to cure someone of the disease of addiction. We look at them as a bridge to long-term recovery, to give them back some of those pleasure neurotransmitters, to allow them to get through that post-acute withdrawal syndrome, to allow them to get through those first few months to years of recovery so that they can feel normal enough to enjoy the gratifications of daily living and also to engage in the very important biopsychosocial and spiritual treatment that is so important to long-term recovery. That is really where they learn how to retrain their brains to think in healthy patterns, change their negative behavioral patterns into positive ones. So they're really both key components to recovery.
Absolutely. And you know, I just want to reiterate, there's no magic pill, right? There's no magic pill, no magic button. There's nothing on the back of somebody's head that you could flip and, you know, flip the switch and everything just changes. You know, this takes work. And, you know, part of this is the medication. That's why I call it medication assisted treatment. And then the other piece of that is through the right therapeutic interventions, the right rapport building, the right, you know, treatment. In general, people get better. I mean, that's the important piece to always recognize, right? There's no like one thing, and one size doesn't fit all. You can't treat everybody the same way. One person, something might work very well for; another person, it may not work at all for them. You know, so it's definitely, you know, not a, you know, there's no cookie cutter way to do this, right? And
I don't know about you, Steve, but that's why I find this work so gratifying, is because patients get better and their whole lives change, and you can have such an impact on not only the patient but also the families, their loved ones, and it's just extremely wonderful to see them recover in such a robust manner. So
couldn't agree more. So we're going to talk a little bit about the perfect storm going forward, because, you know, one thing about COVID-19, you know, we look at this and, you know, we have a perfect storm going on to drive. Unfortunately, we're seeing a lot of people come back into treatment, people who've relapsed after a long period of time. It's difficult for people who are just getting into recovery to stay sober and clean and continue their recovery process, because we have things going on right now that are kind of anti what we used to tell people to do, right? So we would tell people coming out of treatment, you know, go to meetings, get a sponsor, get a home group, you know, work and get a job, you know, get yourself out of some of your financial holes that you're in, you know, and, you know, face everything and recover, right? We talk about that word fear, face everything and recover instead of running from it, right? You know, and now we're in this situation where, you know, because of the COVID-19 pandemic, we have to kind of reverse ourselves a little bit, try to figure things out in another way. So now you got social distancing, isolation. These are all anti kind of recovery things, unemployment, financial stress. These are all things that could drive somebody back into addiction. Remember, these are individuals who have been coping with, a lot of their stressors by using drugs and alcohol, right? And it's eventually developed into a dependence. And I try to, we talk about substance use disorder now, but, it used to be abuse and dependence, but, the dependence is still dependence. You still get into a point where your body is physically dependent upon it. And that can change with the right treatment. However, you're dealing with, when we tell somebody to stay away from people, and when we used to tell them, go around people, make sure you're around people in recovery, it becomes very difficult. And like I said, we're seeing people come back in to treatment now who've had significant periods of time, not just because of that though, but because of, unemployment. And we've had a tremendous amount of people in the country unemployed. We have severe financial stress, a lot of stressful language going on. There's a whole lot of social unrest right now happening as well, which also drives all this anxiety and fear. And then what do people want to do? People are hardwired to be comfortable, right? We want to get comfortable. Well, if I'm uncomfortable enough, I might start to go into a whole nother, I might go back to what I know will make me comfortable, even temporarily, but it's going to make me comfortable for a minute. And, unfortunately, it's going to lead to a whole bunch of other problems. So outbreaks are extremely stressful. When we get into, looking at infectious disease outbreaks, they include fear and worry about your health. People become terrified that they're going to get sick, that they're going to have, that they're going to get COVID-19 or going to end up in a hospital. There's changes in sleep patterns due to this fear, changes in eating patterns. There's a thing in recovery, say hungry, angry, lonely, tired. We look at, we tell people who are trying to stay clean and stay sober and stay in the recovery process that, don't let yourself get too hungry. Don't let yourself get too tired. Don't let yourself, get angry, and these are important things: hungry, angry, lonely, tired. And you don't want to let yourself fall into any of those things. And if you do, you got to figure out a way out of that. Well, when you're dealing with an extremely stressful outbreak like this, it's not hard to find yourself in those situations and very difficult to dig your way out. So, concentrating, sleep, health problems. I mean, we know that people were not going to the hospital or doctor's offices to take care of their other health problems, right? So we had COVID-19 going on. Nobody wanted to go to the hospitals. Nobody wanted, as a matter of fact, hospitals right now are trying to they want people back. They're saying, hey, come back because, we're dealing with this. We're able to treat you safely. And that's important to recognize that. The hospitals now are able to, take care of you. So if you have other conditions, don't delay. Because, I've never in my life heard a doctor say, thank God we treated that late. You want to make sure you get stuff treated and your chronic health conditions taken care of as well if you think something's going on. We also know that people with, behavioral health and substance use conditions are at greater risk than the general population for, developing, COVID-19 and they can develop it more severely because they've beaten their immune system up out there. If you're using a lot of drugs and alcohol and you become dependent upon drugs and alcohol or drugs or alcohol, and you're running yourself down and then you come in contact and then, and you get sick, you're more likely to get sick, number one, but you're also more likely to get sicker because you don't have the immune system. It's been beat up enough to where you're not able to fight it off. And we know that, all the isolation, we talked about this earlier, that has created the, a increase in overdose deaths as well. And that's something we spent a lot of time on. It's important to understand that. Some of the other stressors, and then patients have reported this to me when they hear certain words, because I was just, I asked people, what's going on right now? What's stressing you out? And, new normal is one of the big buzzwords. We hear that now a lot. And it even stresses me out.
Absolutely.
To stress you out.
I really hope it's not the new normal.
It's like, it sounds like, okay, when you say new normal, that's like, all right, we just kind of, and I think the fact that this didn't happen over a long period of time. It's not like we said, okay, this is going to, it took years to get here. It was like fast. And I think, when you get into that, the new normal, you start hearing new normal, new normal, new normal. People think this is forever, and hopefully it's not. Hopefully, I don't know that we'll ever be where we were. I think we'll be a little different, but I hope we can get as close as possible. I mean, I don't know about you, but I'd love to see us start to be able to have gatherings again and things like that. I think that would be wonderful. It's just, I want to make sure we're all safe in doing it. That's the important piece. Social distancing is stressful. Self-isolation, super stressful, especially to a recovering person. Shelter in place, that sounds like something's going to drop on you any second. These are all things that cause anxiety. Pandemic itself, the word pandemic, wear your mask. I mean, we've probably seen videos of people yelling at other people about not wearing their masks. I mean, there's a lot of stuff going on. I spoke about social unrest a little while ago. That also causes a lot of problems.
We have kindergartners going to school with masks on. I mean, it's all very psychologically distressing.
Yeah. And like I said, we need to do it right now. Hopefully, as we go forward, because we don't really know what kind of psychological impact this is going to have on the young people as well. And that's something, that's a whole nother talk, but, it's something to think about. But hopefully we get through this, in a short period of time so we can start to resume some semblance of normalcy. Couple things we're concerned about, and we talked about this. We talked about substance use disorders. We're concerned that there's going to be a sharp increase as we get more numbers post-COVID. We know that we're already on track to beat in overdoses. We know that alcohol sales are up. So we know, and believe me, in treatment, we're starting to see the people coming in. So we know this is creating an impact. Trauma is another thing that we're seeing a lot of. Now, think about this. Trauma, when you're seeing all this stuff and you're constantly bombarded by media and all these things that are happening right now, constantly exposed to stress, it's going to cause trauma.
Absolutely.
It's going to cause trauma. There's in addiction services and in substance use disorders, trauma is a huge piece of that. We always assume that any person suffering with the disease of addiction who walks into our office has some type of trauma. That's the assumption right off the bat. If we find out that's not true, I mean, I personally think that addiction itself, living that way at times is traumatic. Absolutely. So I think there's at least that trauma going on in every single person, probably more significant trauma. And then when you have all this social unrest and COVID-19 and all this stressful stuff that we talked about on top of that, you really perpetuate a lot of traumatic, post-traumatic stress disorders and other types of traumas that could be going on. Suicide rates, we know, are another big concern because we know the suicide hotlines have reported large increases in their call centers. So that's another big concern for all of us.
All the deaths of despair, we call them, are on the uprise, unfortunately.
Yeah, and like I said, it takes a little while to get all the solid numbers, but I think those numbers, unfortunately, are going to be higher than any of us would like to see. I don't want to see any, to be honest with you, but sometimes, like I said, in these situations, these are things that unfortunately are cause and effect, so to speak. So coping with stress, I mean, I think it's so important to cope with, to figure out ways to cope with stress, especially in times like these. How do you cope with stress, Dr. Caldwell?
Well, I have to make a very concerted effort to set aside time to do things that I find enjoyable. And it's very hard with all the competing demands on my life right now. But so I definitely set aside time for yoga. That's my thing. I also like to take walks with my son in the evening. So I just make it a rule that during this amount of time every day, I'm going to spend on myself. So
it's important. And we both know that we're both very busy, but we both find ways to try to get that little piece in there. My coping skill, I exercise a lot. A lot of people think I'm a little fanatical about that. I meditate every day. I love yoga. I'm a big fan. I do Kundalini yoga, which I love to do. Matter of fact, I tried hot yoga once, never again. Some people love it. Some people love it. It was like 100 million degrees in there. And I thought I was good, but hey, it's great for you. If you like I said, for me, it wasn't good, but a lot of people, my wife loves it, But yoga,
Practice makes
yeah,
perfect.
practice. I guess I got to keep going. I mean, but then I could sit in a sauna. So I don't know what that's all about. But so here's some tips. Take breaks from watching TV, watching media, watching the news. Get away from that stuff for a while. Take breaks from it. You know what? I used to watch the news every morning. I stopped, and I'll tell you, and I feel better every day now because I'm not saying you shouldn't be informed, but you should. You should be informed, but you should just kind of limit how much of that you're exposed to, because I think it's just going to cause a lot of stress. When you look at social media, I mean, some people, you spend way too much time, in my opinion, on social media, and that could cause a lot of stress as well. Take care of your body. Take deep breaths, stretch, meditate, take a walk, eat healthy, eat balanced meals, get some exercise, get plenty of sleep, avoid drugs and alcohol. The thing about drugs and alcohol, they may make you feel better for a minute, but they're going to eventually make you feel worse. I mean, they have a rebound effect. Make time to unwind, try to do some activities you enjoy. And like I said, take walks, walk on a trail, go for a run, do something, because you don't want to be glued to that constant information. I think for the first time in history, we have such a rapid degree of information coming in all the time that we could really just get bombarded with it. And I don't know how good that is for our brain. I really don't. So that being said, recovering during a time of uncertainty has been challenging. It's forced a lot of operations, and facilities to operate differently. It forced, a lot of outpatient programs to go online and do Zoom meetings. I think AA and NA is doing a lot of Zoom meetings right now. Some of them are starting to come back a little bit, which is good. They're limiting the amount of people, I think, somehow. But there's a lot of things. You could get recovery apps now that track your sobriety. You could have connection to a therapist through these recovery apps or online. E-access to therapy. You have connections with trained counselors. You can message those people through some of these apps. There's track your treatment plan apps. There's set reminders. There's daily journals. And other helpful videos. It's really important. And like I said, Zoom meetings, Zoom, AA, NA, or even some of the outpatient programs have switched to Zoom. Maybe not Zoom either. There's a whole bunch of different ones that do that, but Zoom is just the one that I'm thinking of right now. And telehealth, you could access a psychiatrist, therapist, MD through telehealth right now to take care of your health if you can't get to one in person. You could also get medication-assisted treatment this way. So, I mean, we see a lot of, commercials for that.
That one of the very few silver linings, I'd say, to the COVID-19 pandemic is that there's been a loosening of regulatory barriers around addiction treatment. So the addition of telehealth to addiction treatment, the ability to more widely prescribe medication-assisted therapy, is one of the few silver linings that I can think of that has occurred during the COVID-19 pandemic. But I do hope that it means that, it will mean improved care for our patients for decades to come.
Yeah. And we've been moving in this direction anyway. I think we just stepped on the accelerator, and now we're I think at the end of the day, we're going to end up in a very innovative place. I think we're going to end up in a very innovative place where, we were kind of going there and it would have taken years and years and years to get there. But now I think just like the COVID pandemic kind of happened over, a very short period of time, we've also been forced to adapt in a very short period of time. And we're going to end up in a place where we have kind of like the hybrid effect. We're going to have the traditional philosophies and therapies mixed with the technology, mixed with medication-assisted treatment, mixed with all kinds of other things that we're trying to come up with and to try to take care of people who are suffering. And that's the most important thing. And we also need to remember that there is hope. People get better. People get sober. Even in times like this, people get sober. I don't want to be all doom and gloom here. There is hope after dope. Every person can get better. It's just a matter of finding the right treatment, the right person to talk to, finding your right mix and match and your right motivation to get better. So really important.
Absolutely. So we hope you found this presentation helpful. If you or someone you know is struggling with addiction, Hackensack Meridian Health is here to help. For more information on our addiction services, please visit our website listed below.
Thanks for tuning in.
Thank you.
Hi, my name is Don Parker. I'm the president of Carrier Clinic and of all the behavioral health services across the Hackensack Meridian Health System. As you have just learned, feelings of heightened anxiety brought about by the spread of COVID virus can manifest themselves in a variety of harmful behaviors, including the increased use of drugs and alcohol. As a matter of fact, evidence shows that alcohol sales, unbelievably, are rapidly on the rise, up more than 60% in one national study since COVID-19 outbreak. And experts believe that the same is true for medications one could get in their local pharmacy or find at home in their medicine cabinet. Our presenters on this important subject, Dr. Juliet Caldwell, who is herself an expert in addiction medicine at Hackensack Meridian Health, and Steve Drobushevsky is the director of Hackensack Meridian Health's Retreat and Recovery at Belle Meade, formerly known as Blake Recovery Center, are well acquainted with those challenges posed by COVID-19. That's why they, along with everyone who works at Hackensack Meridian Carrier Clinic, want you to be fully equipped with the right tools to fight the dangers of drug and alcohol. I hope you will take their advice to heart, and if you or a loved one needs help, to seek it out immediately. That help is available at the Retreat and Recovery at Belle Meade, an inpatient treatment facility located on the grounds of the Carrier Clinic campus, as well as the Retreat and Recovery at Ramapo Valley, a very new and exciting outpatient drug and alcohol treatment facility that opened in early September in Mahwah. It's an inpatient treatment program right behind it, which is scheduled to open as the Retreat and Recovery at Ramapo Valley inpatient facility in 2022. Both facilities adhere to a philosophy of caring and compassionate treatment laid down when Carrier Clinic was founded in 1910 as the Belle Meade Farm Colony and Sanitarium by John Joseph Kindred. Dr. Kindred's vision, in his own words, was to establish and maintain a colony for the care and treatment of sick persons, and particularly for the care and treatment of nervous and mental diseases, and also allied health diseases. As we have filled that mission pledge in all that we have accomplished in these past 110 years. Dr. Kindred's Belle Meade Sanatorium provided humane personal treatment and a restorative farm setting, and we continue to cultivate those same life-saving treatments and values even today by offering the broad spectrum of behavioral health services, modern psychiatric services, addiction care services, not only at our Belle Meade facility, but by extension throughout the entire Hackensack Meridian Health Hospital network. Everyone at Hackensack Meridian Health Carrier Clinic, along with our entire network of healthcare team members, thanks you for your time and your attention in today's program. Our mental and physical states are interconnected. We know that. And how to treat them as equal partners remains the key. I urge you to go to thecarrierclinic.org to learn more about us. You can see that web address right now on your screen, along with the URL for Hackensack Meridian Health, which is a fantastic resources for your healthcare needs. Hackensack Meridian Health Carrier Clinic is also grateful for the many contributions it receives from members of our community, private foundations, public foundations, and the many corporations. Thanks to these generous acts of philanthropy, Carrier is able to provide the most compassionate and comprehensive care to those who need our services, and we are able to expand our current programs and explore new offerings to improve the lives and conditions of those we treat. If you'd like to make a tax-deductible contribution to these effects, please visit the website you see below. A gift of any size is greatly appreciated. I'd like to also extend my sincere appreciation to our program sponsor. Each is a valued supporter of critical education that we need more of in mental health and addiction. Please check our website for the date and time of our next program. That discussion will center on the big question of where do we go from here? And what will the world look like post-COVID-19? The truth is, no one knows the answer to these questions, at least not yet. But we're here to try to break it down for you. Until then, may you be happy and healthy and safe. And please seek appropriate help if you are in a crisis.
All right. Well, thanks, Don. I appreciate, those kind words and those wonderful remarks at the end there. We are now going to take some questions. Hope you all enjoyed the presentation, and we have some questions starting to roll in. Dr. Caldwell, do you want to take the first one?
Let's see. First question. I have young teenagers at home and obviously worry about their exposure to drugs and alcohol. What are signs I should look for that would be a reason for concern? Okay, so that's a great question. There are lots of signs that you can look for. Any sort of sudden change in behavior, if they start holding away in their room and isolating by themselves, that's something you can look for. If there's a sudden change in grades, usually for the worse, if their grades start to deteriorate. Another thing that you can look for is a change in the peers that they hang out with, their social group, their friends, if there's a sudden change in that. Another thing is if they do vape, you certainly want to know what is in the jewel that they're using. It's oftentimes very hard to tell. There can be nicotine in there, there can be marijuana in there or THC. And if that's the case, then any addiction to any substance, whether it's nicotine or marijuana, is sort of a gateway to more addiction. What else do you have to add?
Yeah, and changes in sleep habits, increased anxiety. I mean, you mentioned changes in peer group. I think that's really important. Changes in mood swings, agitation. Missing things around the house could be a sign of substance abuse. Pinpoint pupils, unreactive pinpoint pupils, are definitely a sign of opioid use. And one of these things in themselves may not be indicate a definite issue with substance abuse, but when you start putting a few of these together, it could certainly be warning signs and something you should look for.
Definitely. And you want to have a dialogue with them about it. You don't want to start off in an accusatory manner. You just sort of want to inquire in a non-judgmental and non-accusatory fashion about what's going on with them. We notice certain things have changed about your behavior.
Looks like we have another question.
Yep.
I'll take this one if you don't mind.
Yeah.
What addiction services does Hackensack Meridian Health offer? Well, I'll tell you, we offer a wide variety of options, of treatment options for substance abuse. We have a continuum of care. It's a very large system with a lot of things going on, and we are trying to help as many people in the state as possible. We have JFK Medical Center, which offers outpatient services for substance abuse. We have Booker Behavioral, which is in Shrewsbury, that offers substance abuse outpatient treatment, both IOP and traditional outpatient. Jersey Shore Medical Center, they also offer outpatient services. Of course, the Blake Recovery Center, which is a 40-bed inpatient residential detox and rehabilitation unit, located on the grounds of Carrier Clinic, HMH Carrier Clinic. We also have been ranked #1 by Newsweek for addiction treatment facilities in New Jersey, which is a huge honor. We're all very, very happy about that. We've been celebrating that for a while, since that happened, and it's definitely an honor to be ranked as #1. And we also are, we have the retreat and recovery at Ramapo Valley, which is, going to be open very soon. The outpatient services will be open very soon. And then we're going to be following that up with a very large inpatient residential that's pretty much a mirror of the Blake Recovery Center up at the retreat at Ramapo Valley, which is, a huge, it's going to be a pretty big facility. So we're really excited about that. And hopefully that we'll get that open as soon as possible as well to help, once again, as many people as we can in the state that are suffering with this, very difficult and sometimes very mind-boggling disease that we're dealing with every day. So, and we have another one. You want to take this one?
Yeah. What happens if someone relapses while receiving medication-assisted therapy? That's a great question. In general, when that happens, and it's very common, it can happen whether you're receiving medication-assisted therapy or not. Relapse is often part of the process of recovery. But the goal is to sort of escalate care in that case, not to take away care. So, we don't kick people out of programs. They're not going to get punished because they're relapsed. You can sort of think of it as similar to the treatment of diabetes. If someone's put on insulin and also told to diet and exercise and lose 20 pounds, well, if they come back, 2 months later and they've gained 15 pounds and enjoyed a lot of KFC, you're not going to punish them by taking away their medication. You may, in fact, increase their insulin. Well, the same goes for medication-assisted therapy. What we're actually finding these days is that patients require higher doses than we initially thought to treat cravings for substance use, for opioids. So where we originally thought 8 milligrams was enough, now we're finding some people need 16, even 24 milligrams to treat the cravings that go along with opioid use disorder. We may also bring them in for an increased number of visits, increase their counseling, their engagement in psychosocial behavioral therapy. So yes, that's generally what happens as we increase the level of care if there's a relapse. Okay, we have another question.
Yeah. Okay, I'll take this one. How can I help my loved ones stop drinking? This is a great question, by the way. It's a very common question. It's a very good one. Because I think a lot of times family members want to jump in and try to stop or put a blockade up or, babysit or, try to really lock down their loved one who may be drinking or even using drugs. I mean, I would just equate that to also the drug addiction piece. And it's important to understand, because it could be very frustrating if we have a loved one who's using and we cannot stop it. And that's where we have to kind of get into, the first step in addiction recovery is we're powerless over our drugs and alcohol and our life has become unmanageable. Well, I'm sure family members can relate to that too, because there is, a certain degree of powerlessness that we have when our loved one is using. You can't stop someone from drinking. You can't stop someone from using. But here's the but you don't have to support the continued use. We hear a lot about enabling. We hear a lot about codependency. These are things you got to understand that can be, very detrimental and very difficult for families to understand. And we want to help them. And sometimes we find ourselves making excuses for the addict, calling into their job for them when they drank too much the night before, or they can't come in because and that's all enabling behavior, and that stems from codependency. And if you really want to understand codependency, think of it as a big roller coaster. And the addict is, or the addicted person, the person suffering with the disease of addiction, is in the front seat of that roller coaster, and everybody else in that person's life is on that roller coaster ride with them. So wherever they go, you go. They're having a good day. Yeah, maybe you're having a good day. They're having a bad day. You're having a bad day. Your emotional state depends on theirs. So trying to, and getting back to the actual question, which is how do I help someone? How do I stop my loved one from using? The best answer for that is, you have a conversation with them when they are lucid enough to have the conversation about seeking help. They may not be willing. If they are not willing, then you have to understand that you need to help yourself at that point, because you cannot make them stop, but you can't control what someone else does, but you can control what you do. There's plenty of groups out there that you can seek help from. Al-Anon, Nar-Anon, Parent Support Group of New Jersey, one of my favorite groups to send family members who have sons or daughters or loved ones, basically who are dealing with this disease. It's really important, they get support that you need. Very, very important. Stop enabling, set boundaries. Talk about the expectations. What are your expectations of your loved one? Don't back down. If you set a boundary, don't back down on it. Hold true to it. It's not about punishing them. It's not about browbeating. You can't browbeat someone into stopping drinking. You have to, an addict has to hit a point where they decide at some point that they need to change. Doesn't mean that they come into treatment all ready to change. Most people come in with all kinds of external motivations that we have to understand. External motivation is family pressure, job jeopardy, legal consequences, things like that. Now, when we go into understanding what a bottom is, that's where you really kind of, what is rock bottom? Rock bottom is when a person has enough consequences in their life and has suffered enough from their disease that it actually hurts less to get better. It hurts less to stop using. The pain becomes great enough, reinforces the need to change, and we are now become willing to do something about it. So you got to get off the roller coaster, stop enabling the behavior. And I don't want anybody to think, hey, you did not cause this. Just like you can't stop it. You didn't cause it. You didn't create it. You didn't make somebody go out and start drinking or start using or become an addict. You cannot create. I'm not that powerful. You're not that powerful. But we also have to understand sometimes we only have the power to help ourselves. So get some support, get some people around you who can support you. And hopefully, what I do know is when one thing changes, something else generally does. If you stop doing the behavior that, if you seek help and start to get support, something changes in that system. And when one thing changes, something else does. So one affects all. That's how the family system works for the most part. So seek out your own help. Despite whether they're ready or not, you should still seek out your own help because this could be a difficult road for families and the patient and the identified addicted person as well. So just some stuff there to keep in mind. That was a very long answer, but it's the best one I have.
That's a great answer.
So.
Okay, we have another question. Let's see. You mentioned medically assisted therapy. How would someone obtain more information about this option if they had a loved one struggling with substance use disorder? Okay. Well, a great place to start is always with your primary care physician. As addiction has become more and more prevalent, it's certainly made its way into the primary care field. So a lot of primary care docs out there know how to treat addiction and can help even assist getting the patient on medication-assisted therapy. If your physician happens not to be familiar with addiction treatment, you can certainly look into the many HMH facilities that Steve and Don Parker talked about. There are always fail-safes out there. For New Jersey, there's a program called Reach New Jersey. If you call that number, they can help locate practitioners in your area for addiction. If you're the kind of person who likes to do your own research, and I know there are a lot of people out there like that, there are a couple of very reliable sources that I would recommend. One is the SAMHSA website, which is the Substance Abuse and Mental Health Services Administration website. That's a mouthful. But if you go to their website or the ASAM website, which is the American Society for Addiction Medicine, and simply type in MAT, it'll give you all the most recent data and literature about the efficacy of MAT and who it may or may not be appropriate for. So those are some suggestions for those of you who are interested in more information.
Yeah, and that's all really good information because, MAT has really kind of revolutionized a lot of what we do. It's added that extra assistance to the treatment process. And, one thing I always put out there is that, there's no magic pill, there's no magic button. However, these things help us allow somebody to have the room to be able to recover.
Absolutely. Yep.
So, all right, looks like we have another question. My family member is considering addiction treatment at the Blake Recovery Center in Belmead. What steps can my loved one take to get admitted? Well, it's pretty simple. We try to make it as easy as possible to get admitted. I mean, basically, you can call directly. Our appointments are, we do make appointments to come in, but they're very quick. We ask that you are ready to come in when your loved one is ready to come in. When the call's made. We don't make appointments like a week out, just because generally we're holding up a bed that somebody else. And in addiction, it's just one of those things where things change very quickly. Someone, you got to strike while the iron's hot. If someone's ready to go in, they should go in right at that moment, right? So, you could call in, number's 908-281-1000 and press 0 for the operator and basically, just tell them you want to be admitted for addiction services, and we will make an appointment within, the day. Probably a lot of times it's the same day. Most times it is, and you could come in and we'll evaluate you and get you over to where you need to be, and start the treatment process. So,
Awesome.
So, I just want to, thank you, Dr. Caldwell. This was a lot of fun. I enjoyed this conversation and talking about this. And,
we have lots to learn from each other. So yeah.
Absolutely.
Yeah.
Absolutely.
Thank you.
And I hope everybody out there enjoyed it as well. Thank you all for joining us this evening, and we hope you found this presentation beneficial. Again, please visit Hackensack Meridian Health website to find more information about our addiction and behavioral health services. Thank you again, and we appreciate your time as well.
Thank you. Good night.